So the basis of dry needling is to find areas of pain, inflammation, muscle spasm, and what we'll do is we'll put the needles into those areas.
But how do we do that?
Oh, sorry.
With these little puppies right here.
So we find those areas by using our hands. So we're gonna feel around the muscles, see how the joints are moving, and check in with the patient. You know, is this tender? Is this sore here? Have you been experiencing issues here?
Yeah, because that's really our
forte.
Our speciality in chiropractic is that we've been actually trained to be more sensitive to our sense of touch and understand the anatomy that's underneath the skin. That's how we can figure out where the needles need to be.
We are using acupuncture style needles, so these are very thin, small, flexible needles. And what we do is, after we've found those areas that we think need to be addressed, we'll put the needles into the tissue. So the needles go to varying depths within the tissue, just depending on what area of the body we're working in. Sometimes they're only going in maybe 1/4 of an inch, 1/2 an inch. Sometimes they're going in 3 to 5 inches, just depending on the thickness of the tissue, the size of the patient.
So once the needle goes in, what I do is I will spin the needle. And if you think of spinning, I mean just tighten the needle, because the needles are machined smooth, but they have microscopic burrs on them. Those burrs are actually big enough still, though, to catch the connective tissue within the layers of the muscle tissue that we put the needle into. And when I say spin, think of a hurricane on a weather map, where the eye of the hurricane is the needle and the clouds are the connective tissue. It's just to force a little bit more change within the tissue. When we're done, we pull the needles out. We'll then bring and put a hot pack into the area so that we can draw the blood into the area. We'll see those microscopic little lesions, those little areas of damage, and that's when the healing process will begin. And so we're basically tricking or helping the body to facilitate healing in the area.